systolic blood pressure before we complete the full blood pressure. So obviously we would have introduced ourselves to our patient. We would have checked their ID on their name band. This patient has multiple different names, and we will go through this with them. So what we need to do is make sure that we pick the right cuff. Doing the OSCE exam, it's likely that you'll have multiple cuffs to choose from, small, regular, and large, or maybe there might even be extra large. Don't be surprised, but you will have to connect the bulb to your sphygmomanometer when you pick the cuff. Okay, so you will need to put your cuff together once you've picked which one it is. Okay. Once you've got your cuff selected, we're going to place it around our patient's arm. Now we are going to need to find their brachial artery. So we need to palpate where their brachial artery is. And then we need to remove clothing out of the way. And then we need to place the blood pressure cuff 2 fingers above the antecubital fossa. Okay. It's a little bit challenging on an actual mannequin because my mannequin does not flex and move. However, we just need to make sure it's 2 fingers above his antecubital fossa. Okay. And then to get the estimated systolic, we need to palpate the radial pulse and blow up, inflate the cuff. Okay. Alrighty, so my mannequin has kindly given me an estimated systolic of 100. So we need to then inflate the blood pressure cuff 30 above that. Okay, so I need to inflate the cuff to 130. So I am just going to remove my headset quickly. Hang on a second. And then you're going to slowly release that blood pressure cuff down. And then you will have your reading. So my patient Simon, his blood pressure is 110/60. So he's nice and healthy, and he's within the normal range. So that's how you would be expected to do the blood pressure. You need to gain the estimated systolic blood pressure first and then complete your actual blood pressure. No more than, so you need to inflate the cuff 30 above the estimated systolic.